Hi, I'm Linda. In this video I shall explain what is psoriatic arthritis and how it can lead to psoriasis, the symptoms, diagnosis, and when to see your doctor, and much more. There are 100 different types of arthritis where psoriatic arthritis is one. Psoriatic arthritis can attack the joints, which causes swollen, stiff, and painful joints, and is a long-term condition. Psoriatic arthritis is like psoriasis, where it attacks your skin and can become progressively worse. When it becomes severe, there are some risks of joints that may become deformed and damaged permanently. Surgery could be needed, but if the condition is found early, the progression can be slowed down, with the joint damage becoming preventable or reduced. Psoriatic arthritis causes painful joints, often in the knees, ankles, hands, and feet. Also, it differs from person to person. Some people may have severe pain and problems, others may have mild symptoms in one or two joints, or others may be in remission. Psoriatic arthritis could have several parts of your body affected. They could include having spine disease and inflammation of the toes and fingers called sausage fingers. Other symptoms could be inflammation of the ligaments and tendons, commonly in the Achilles heel. Your nails may have lesions. You could have inflammation, pain, and swelling of the joints, especially the hands, arms, feet, and legs. In some cases, it can attack your skin cells by mistake. This is called skin psoriasis. In the early symptoms, it could be confused with other conditions, such as one person could have enthesitis, inflammation of the tendon or ligaments, whilst another person may have dactylitis, sausage fingers. If you have any of the following, you may have the same symptoms as psoriatic arthritis, so you need to see your healthcare professional if you have any signs of the following: pain in the sacroiliac joint or bottom of the spine. See any changes in your fingernails or toenails, including holes, discoloration, pitting, or becoming soft, and uveitis, which is inflammation of the eye. You also feel fatigue, redness, pain, and swelling of the joints, stiffness, and pain in the joint first thing in the morning, but gets better as you move your body, reduced motion, swelling, and sausage-looking toes and fingers. Scalp psoriasis has symptoms of a rash on the scalp, and psoriasis plaques have a skin rash that develops on the elbows, knees, and around the ears. Enthesitis is a pain in the tendon or ligament in the Achilles tendon, plantar fasciitis, or the elbow, such as tennis elbow. Unfortunately, 1 in 3 people that has been diagnosed with psoriasis also develops psoriatic arthritis within 5 to 10 years later. Both conditions come under rheumatoid arthritis, where the immune system mistakenly attacks the healthy tissues. If you have any of the following conditions from your psoriasis, you also could develop psoriatic arthritis. They include genetics, environment. This could be either viral or bacterial infections. Other causes could affect the scalp or groin. If you are overweight or obese, there are several factors which are high risk, such as if you have psoriasis, you could be at significant risk of developing psoriatic arthritis, or if you have a parent or sibling with psoriatic arthritis. Another risk factor is if you are an adult between 30 and 55. You are also at high risk of developing conditions like cardiovascular disease. Other risks are hypertension, metabolic syndrome, and diabetes. If you are a smoker, you must stop, or you have had physical trauma. The aim of treating psoriatic arthritis is to slow the progression and lessen the symptoms, which can improve your quality of life. The treatment could be medication, non-steroidal anti-inflammatory drugs, or disease-modifying and traumatic drugs, biological therapy, or corticosteroids. At first, your doctor may prescribe you non-steroidal anti-inflammatory drugs. These drugs can help relieve the pain. They could include ibuprofen or diclofenac. For my osteoarthritis, I rub on the areas of pains a clear gel called Fenbid, which is in the ibuprofen family. I use it 3 times a day and find it works. Or your doctor could give you 2 inhibitors called Coxibs, but these drugs have side effects, including aches, indigestion, and stomach ulcers. The second is disease-modifying anti-aromatic drugs, which can block the effect of the substances released when your immune system attacks the joints. But these also give you side effects, such as loss of appetite, nausea, diarrhea, and abdominal pain, also a rash allergic reaction, liver problems, and increased risk of infections. Number 3 is corticosteroids. These helps reduce the pain and swelling of the joints. But if you have only one joint inflamed or swollen, the doctor can inject medication into the joint directly. This can provide fast relief, with few side effects. Corticosteroids could last for a few weeks to a couple of months, and can be taken in tablet form or injection into a muscle. But these can cause substantial side effects. When used for a long time, if you take it in tablet form, the side effects could be increased appetite, leading to weight gain and obesity. Other symptoms are acne and rapid mood swings. This could mean becoming aggressive, irritable, and short-tempered with people. Also, your skin becomes thin and easily bruised. You could have muscle weakness or a long time for a wound to heal. Number 4. Biological therapy is a new type of treatment for psoriatic arthritis. You are offered this method if other drugs do not work or are unsuitable for you. The biological treatment works on stopping specific chemicals in the blood from attacking the lining of the joints. But again, there are side effects to these also, such as a reaction around the injection site. You may have redness, swelling, or pain, but they are generally not serious. Other side effects can sometimes include liver, kidney, and blood count problems, so you will have regular blood and urine tests, or you could develop an infection, such as a sore throat, high temperature, or diarrhea. If this happens, you need to see the doctor as soon as possible. A small group of about 5% of people that have psoriatic arthritis can develop arthritis mutilans. This disease is a severe, painful, and disabling group of psoriatic arthritis. Over time, this can destroy the tiny bones, particularly the hand and feet, leading to permanent deformity and disability. In addition, you could develop ankylosis, meaning that your bones may fuse together. As in psoriatic arthritis, the arthritis mutilans causes your immune system to attack your healthy tissues and cells. Research does not know why the immune system attacks the healthy cells and tissues, that results in joint inflammation and overproducing skin cells. But it could be a mixture of genetic and environmental factors. The symptoms of arthritis mutilans could be severe pain and swelling in the joints of your hands and feet, and the bones could fuse together. Before arthritis develops, you may have skin lesions, fingers and toenails become thick and lift from the nail bed, called subungual hyperkeratosis. Your joints and bones in your fingers may become unstable and can be pulled in and out, called operaclase, and the arthritis mutilans usually appear at the age of 40 to 50 years. But could occur in children and older adults. When you experience any of the symptoms, you must contact your doctor immediately for proper diagnosis, because if it does not get treated, your hand and feet can become deformed permanently. The doctor may send you to a rheumatologist or dermatologist that will ask some questions and will be diagnosed if you have 3 or more points from the following list. Number 1, if there is any family history of psoriasis. Number 2, conditions of your nails such as the thickening of the skin under your nails. Number 3, an X-ray may show new bone growth near a joint called nodes. Number 4, at least 3 painful and swollen joints that have lasted 6 months, or skin lesions. If you have been diagnosed with psoriatic arthritis by your doctor, they will ask you to fill in a questionnaire. This will help the doctor to decide whether to refer you to the rheumatologist, who is a specialist in conditions of the joints. The rheumatologist will diagnose you for psoriatic arthritis and rule out any other type of arthritis, such as rheumatoid arthritis or osteoarthritis. The rheumatologist may send you for a blood test to check signs of inflammation in the body and specific antibodies found in some types of arthritis. They may send you for an X-ray or scan to check your joints. Different people will progress faster than others. The worsening of one or more joint areas will likely worsen the disease, therefore more treatment must be needed. The signs that show your disease is getting worse are flare-ups, which may become constant, and more often, joints have a significant loss of mobility, and bone damage becomes permanent. Apart from the damaged joints, you can also have inflammation and damage to the organs, including the heart, eyes, and the inner ear. You can slow the progress down with the prescribed drugs you get from your doctor. Also, you can slow the process by changing your lifestyle, easing pain, stiffness, and fatigue. Your everyday tasks should be simplified. For example, gadgets on the market can help with your daily tasks, such as equipment around the kitchen or safety bars in the bathroom. A stair chair, if you cannot climb the stairs, and there are many more items that can help you. Just find a near-disabled shop near you, and they will be able to help with your needs. If you have the disease in your hand, you should use your body and not your hands to push doors open. There are also items for the computer to make your life easier, such as a support chair for your aching back. If your size is overweight or obese, you need to slim off, as you are putting more pressure on your already unhealthy weight-bearing joints. You will find that walking will become easier. You may have less pain and inflammation. The conclusion is, the long-term use of drugs can cause some symptoms to be less effective. For example, high stress levels can make your body release chemicals, which can aggravate the symptoms. Stress can trigger inflammation. It would be best if you could consider a therapist, or find a local support group who are in the same position as you are, with your aches and pains. You could reduce your stress by sitting quietly, breathing deeply, meditating, and finding a local yoga or Tai Chi class, walking out in the fresh air, or try muscle relaxation. Arthritis can drain your energy from your body. This means you need to take rest breaks when you feel tired, not when you are already wiped out. When you are diagnosed with psoriatic arthritis, your doctor will send you to a rheumatologist who will give you an X-ray to see your joints. Also, blood tests may be done to check for inflammation present in specific antibodies. The doctor will give you drugs to help reduce pain and inflammation, but there are also things that you can do to help to keep arthritis at bay, such as gadgets that you can buy from your local disability shop. Also, be aware of these symptoms and make an appointment with your doctor early if you are worried about anything and before it gets worse. I am not a medical professional, and this video is for information only. You should consult with your doctor if you are worried about anything. I hope this video has helped, and do not forget to subscribe and ring the bell. If you have any questions about arthritis, you can leave a message below, and I will get back to you.